This is a demonstration on self-treatment for tightness in a mid to lower cervical joint. So in this skeletal model, we have the occiput, the back of the head here, all right? And I'm going to lay it on its side. We have an upper joint where the occiput and C1 connect, and then we have a joint below that where C1 connects to C2. This video does not concern itself with those upper two joints. It's concerned with the C2, 3, 4, 5, 6, 7 joints, okay? Now those joints are towards the back of the head. The upper two joints are towards the front of the neck as well, okay? Now these are called facet joints, and they lay approximately a 45-degree angle. So my hand defines the plane of the joint, okay? And that tells us a little bit about the angle of force that we can use to treat it. Well, these joints rotate and side bend to the same direction. And sometimes the muscles get kind of tight, or even the joint develops tightness that is treatable, and it can feel uncomfortable, it can feel restricted, and you can test it yourself. So here's the very midline of the back. Further down you feel bumps. Up here there's a huge ligament that kind of covers these bony bumps, although you can usually feel the bump of number 2. So what I do to evaluate this mobility of twisting left and twisting right is I lay down on my back and I come to the occiput, I come below it, I come another finger width below it, and then one more below that. And that should take you to C3 area. So I'm in this little groove here that is full of muscle, okay? And now I'm gonna put this person on his back. So he's laying on his back. And in this plane of the body, when the person is laying on their back, then the orientation of those joints is like this, okay? It's a 30 to 45 degree angle this way. So let's just suppose that I'm testing twisting movement. So I would reach across with my left index or middle finger, and I would come beneath the vertebrae. And I would test by lifting up towards the ceiling to see if there is rotational mobility, okay? And so I reach across, and then I come behind it, and I'm just about a ½ inch away from the midline, okay? No more than an inch out to the side. But realize the plane of the joint is like this. Okay, so instead of just lifting up to the right, I'm actually going to lift upward, like in the direction of my left eye. Okay, so that's the important concept. So you reach across and test mobility, but you test it at an oblique angle. Okay, so I'm going to lay down and demonstrate that to you. All right, so here's the back of my occiput. So I just come to the middle, and then I go to the right. We're just going to demonstrate on the right side. So I'm right under the occiput, so that should be C1. I'm going to come down one more finger width, and that should be C2. I'm going to come one more, and that should be C3, give or take. And you can fine tune it, moving your finger up or down, okay? But I'm actually gonna reach across to that area with my middle finger, and I'm gonna point my arm up. I'm gonna spring it. Remember, I said like towards my eye. Let's pretend I could bring my left eye forward 12 inches. We're gonna actually go to that, let's see, scratch that. Bring my eye forward just maybe 6 inches forward. So I'm going to spring it in that direction. Maybe it's less than that. Maybe it's only 3 inches. Okay, a 45-degree plane is what I'm chasing. Even though the angle of my arm doesn't reflect that, the direction of my force is this way. Okay, so I'm going to move my elbow up, and I'm moving in the direction of the elbow. That's what I want to say. I hope that's helpful. So yeah, I lift up until motion stops, and then I do little pulls, little oscillations, okay? And I feel that move. So I'll go down 1 finger width below that, test the next level. Okay, I lift up, and that one feels tight. So if it's tight, then I can maintain that force for 2 minutes. I can also pull or push with my other hand. I didn't sleep last night, so I'm a little bit all over the map, so sorry. But basically I'm pushing up this way. Remember that 45-degree angulation? That's what we're after. Okay? And so we're inducing rotation to the left, but also at a 45-degree angle. And that's how you evaluate, that's how you treat it. So if it was tight, you would just pull it up with your middle finger or your index finger. And you would take up all of the movement, okay? And then you would just hold it there. And you would hold that for 2 minutes. After 2 minutes, you could also do little tiny oscillations, just lifting up with your finger, okay? But remember the 45-degree angle of those facet joints. They stack like this when you're laying down. I hope that's clear. I hope that's helpful. Thank you.